Welcome. My name is Edison Cano, and we're going to discuss the immune system and vaccines in older adults in the following slides. I am an infectious disease fellow at the Mayo Clinic, and I have a particular interest in the immune system. In this lecture, we'll try to describe the immune system in a simplified manner. Also describe the changes of the immune system with aging and the importance of immunosenescence, that is a term we will discuss, as well as the importance of vaccines in older adults. And as a bonus, we're going to discuss COVID-19 vaccination in older adults. Now let's start talking about the immune system in order for us to understand the role of immunity and vaccines. The immune system is an exceedingly complex machinery. It is composed of different cells, molecules, proteins, and even skin, as we will discuss. The immune system is working really hard on a daily basis to keep us alive and healthy and keep us away from pathogens. Because we live surrounded with these parasites, fungi, bacteria, and viruses represented here. And as we can see, the first line of defense for these pathogens in the outside is the skin, and the skin includes the regular skin that we see outside and also the mucosa, or let's call it the inner skin. It is represented here. In the skin, also hair play a role to keep us alive and to keep us healthy. And in the mucosa, inside the mouth, the stomach, and other inner places, we're going to have some glands that will secrete mucus, hence the term mucosa, and that's why this substance will delay pathogens or will have some antimicrobial effects against all these virus, bacteria, or parasites. Now the second line, after we go past the skin, there's going to be different cells, mainly dendritic cells or macrophages represented here, that will serve as a post to alert the immune system whenever a pathogen enters. So these are, we can call them kind of an alarming cells. So these cells will take viruses or bacteria or any other pathogen, and they'll make sure that it gets delivered to the right guys to take care of the pathogens. Another distinction in the immune system is the two types of immune system that we have. One type of immune system, it's called the innate immunity. It's a type of immunity that we were born with, and it's active against many different pathogens without even us having any idea of whether these are pathogens or not. So that is, we have represented here, there is some neutrophils, basophils, eosinophils, we don't need to go into the details, but basically these cells will react to anything that crosses in front of them. And these structures right here that look like little rockets, this is called the complement. That's another very important aspect of the immune system, that you can think of this as different Lego pieces in the blood that whenever they get close to any pathogen, they'll build up together and they'll create holes into the pathogens. So it's a specific type of protein that will react to different pathogens, but it's also part of the innate immune system. So it will take care of any pathogen that crosses in front of them, and they don't need memory or they don't need any other type of signal. It's a very effective way to keep us healthy. Now, the second type of immune system, the one that we call innate, that works really closely with the adaptive immunity, is the one that is less complex than the adaptive type of immunity. So by adaptive immunity, we mean that this is a system that will learn from the pathogen and will become better and better to take care of it. When it is presented one of these particles of the pathogen, this adaptive immune system will learn from it and will deliver a specific proteins to take care of that pathogen. So that system is represented here by these T's and B's. So these are two types of cells that will learn from the pathogen and will deliver specific antibodies to take care of these pathogens. So the antibodies are represented here by these Y-looking shapes. This is the most important pathway that we use for vaccination. So in vaccination, we basically take a piece of one of these pathogens and then give it to one of these cells in the skin or in other tissues. And these cells will present it to the B's and T's to do their job and to create antibodies. But there are two types of responses, we can say. So one is the antibodies that will take care of these pathogens, and also the cellular component, mainly driven by T's here. Both processes are interconnected, highly complex, and these two types of immunity inside the adaptive immunity will be used in our favor when we give vaccines. There are other aspects of the immune system not covered here. For example, inflammation and fever. So those are two key parts of the immune system that will take care not only of pathogens, but will also play a role in other physical injuries when you cut your skin or in electricity, any other type of physical injuries. And we didn't talk about this NK mentioned here. So this is a type of cell that is called a natural killer. So that's it's giving out its role. It pretty much takes care of anything that crosses in front of them. And by that I mean that it eliminates all the pathogens that just crosses behind, crosses in front of this target cell. So we are born with the immune system as a naive immune system, let's call it. And this adaptive part of the immune system will develop with time. But we're all born with the complement we discussed, with these little rockets here, with these cells in the skin that will present different pathogens. And also these cells up here in the top row that will secrete some substances to kill these pathogens. As I briefly mentioned, inflammation and fever play a key role in immunity. But imagine as we learn more, as your body learns more, it's going to react easier. And as we age, the chances of elicit an immune response is higher as we know more and more of these pathogens. All these cells have complex communication systems. They communicate with each other and also with these proteins. And this creates a background communication that in older adults is going to look more inflammatory than compared when we say, let's say, newborns, when they don't have much inflammatory response at the beginning of life. It is also expected that with time, some of these cells are unable to replicate. And we have identified different cells that cannot replicate as good as they were replicating in early stages of life. And that's what is represented here. Now that we talk about the different components of the immune system, it is easier for us to dissect what are the different arms or different parts of the immune system that behave differently with aging. Highlighted here is what happens after 60 years of age. So if we go one by one, so the first graph up here talks about the different frequency of cells. So these monocytes are those cells that were in the skin or in other tissues that will present these pathogens to the adaptive immune system. These tend to go grow higher and higher with age. Same as these natural killer cells, highlighted here in blue. So they tend to increase with age. So you can think of this resulting as an increased capacity of presenting pathogens. But that's not actually true because even though the numbers are increasing, their activity drops with age. Then in the second panel here, we have these B cells. Do you remember those B cells were the ones that created antibodies? And the ones that are highlighted here in blue are the class switch memory. Those mean, let's talk about this as the B cells that already know what they're doing. So those are the ones that keep going up with time. But the cells that are going to decrease are those naive B cells. So we can translate this into a lack of ability to learn new pathogens for B cells. We see the same situation for T cells right here. So these naive T cells, they tend to go down with age. So again, it's the same issue, is the inability for T cells to learn about new pathogens. And I would say that this is the most important fact down here. So this is the diversity of these cells. So if let's say we have the ability to recognize new pathogens, and that ability relies on how diverse is our immune system receptors. But with age, we lost that diversity and we're unable to learn new type of pathogens to react with. So this is probably the most important change with aging. So this change in diversity doesn't only affect learning new pathogens, but it also affects the ability to react to well-known pathogens by your immune system. So take, for example, shingles. At some point at early age, we're exposed to the virus that causes shingles, called Varicella zoster virus. And the first presentation was chickenpox. And after getting chickenpox, that virus just deposited in one of the nerves. And then with age, we see older adults getting bouts of shingles just because the body temporarily loses the ability to take care of that virus the way it was taking care of the virus before. So this process of losing the ability to take care of infections by deterioration of the immune system due to aging is the process that we call immunosenescence. And it comes from the terms of senescence, just like cell senescence, when the cells just shut down with time. We think that that's in part what happens with the immunity as we age. And to this cellular immunosenescence, we also couple physical changes that comes with aging and increased inflammation. The inflammatory background changes with age. We tend to see anti-inflammatory cytokines in more abundance at the early stages of life, and we see more pro-inflammatory background as we increase in age. This is represented here, and these combine to the lack of ability to create new or to learn new different type of pathogens also increases the chances of poor outcomes in the elderly. And many of these can be found in the blood. However, we only understand just a fraction of all these changes of immunity with aging. In summary, the aging immune system, it's composed of the same cells but with decreased function, and there are many cells that increase in number and frequency. However, they have decreased ability to do their proper job. In addition, there is this inflammatory background represented by this flashing red that is composed of proteins, cytokines, and other components of the immune system that keeps activating, and they perpetuate when there is also some impaired function of the cells keeping the integrity of the body. So for example, in the skin or in the mucosa, when we have decreased ability for regeneration with age, we can see skin openings or decreased mucosal barriers that will serve as a port of entry for all these bacteria, viruses, and other pathogens. They can cripple inside these cells and then create more inflammation that adds up to the inflammatory background and perpetuates this cycle of inflammation. And at some point, these mechanisms can give in, and this result in infection when the ability of the body to take care of these pathogens is impaired. Unfortunately, this is part of even healthy aging. Even if healthy aging, we see decreased population of cells that will be otherwise in different proportions at early stages of life. And this is related to the cellular processes that we discussed that will eventually translate in immunosenescence. So we're coupling immunosenescence with the decreased ability of regeneration of the body, and altogether results in increased chances of getting infections or being unable to take care of infections that were already known. So for example, we can take shingles. So shingles at the beginning presented, so when you get in touch with the virus of shingles, that is the varicella zoster virus, that virus initially presents as chickenpox, but then eventually it's gonna end up living in a nerve in the body. And then with aging, sometimes the people get shingles because the body lost the ability to keep that virus in check. Whether this is something transitory and the body just needs some time to get over it, or whether medication is needed, that's all part of a flaw in the immune system that was already working well, trying to keep it, to push it down. But then it temporarily stopped working, and that allows the virus to resurface. Well, at least that's what we think it usually happens with shingles. So boosting this immune system is important, and keeping it healthy is also important to prevent these type of reactivations. Also, in the presence of this decreased regeneration ability, other cells tend to decrease their ability to regenerate, just like these T and B lymphocytes, and that impairs their response against different pathogens or different antigens. But sometimes with booster vaccination, the outcomes can be improved, and some cells can be even, let's say, retrained to recognize other pathogens that were not exposed before. Now, if we factor chronic conditions such as diabetes, hypertension, kidney disease, then we're going to find a different response to the pathogens when these comorbidities are included, just because it impairs the overall health and the overall picture of the distribution and function of these cells changes. The importance of the changes described before translate into increased mortality from new infections, increased morbidity from all infections. So if we want to put an example for each of those, you can imagine that, for example, the pneumococcus, which is the bacteria responsible for lung infections, has been around us throughout our lives. But only individuals 65 years and older seem to be more susceptible to the bacteria. So even if we face this infection before, the body takes it as a new infection and is unable to fight it. And we see high mortality from respiratory infections in older adults. We see the same with increased morbidity from all infections, just take into consideration shingles, as we discussed. An old infection is just that the body is unable to take care of it, and then you have frequent bouts. We can think the same of, for example, herpes virus, and like the virus that will produce some cold sores. And it's also related to the lost ability to take care of these infections with aging. So there is also an increase in inflammatory conditions based on the changes that we discussed on increased inflammatory background. And this perpetuates with increased damaging of the tissues. And also, because of the lost ability of the body to create new antibodies or to react to new type of infections, there's also decreased vaccine effectiveness in this group, in the elderly. Another example of the increased inflammatory conditions, we can take, for example, osteoarthritis, which is the arthritis of big joints like the knees and hips. These also get perpetuated in an inflammatory background that debilitates these tissues and makes these type of conditions a source of inflammation and ongoing inflammation, which is detrimental for tissues in general. And even though we see decreased vaccine effectiveness in elderly people, vaccines are the best proven way to decrease morbidity and mortality from infections in the elderly, as we will discuss in the next few slides. We're lucky to have vaccines that will help with new infections and can also decrease the chances of a bad outcome from old infections. And these are the two groups of infections that we're discussing. So the old infection is shingles here, and the new infections are listed here. That includes COVID-19, influenza, Haemophilus influenza, which is not the same as the influenza, the flu virus. This, in the other hand, a bacteria. We also have meningococcus, pneumococcus, measles, mumps, rubella, 2 types of hepatitis, tetanus, and diphtheria. So I wish we have more vaccines available because there are many vaccines that have been tried in special populations. And we can technically have vaccines for many different other bacteria using the same principles that we use for these vaccines. But the vaccines listed here are vaccines that have been tested in randomized controlled trials with high level of evidence and are widely recommended for the general population. There have been studies on vaccines, for example, for other bacteria that will give you invasive disease or other more deadly bacteria. But this list here includes the vaccines that are recommended for adults and are currently endorsed by the CDC. So we'll go over all these vaccines as we move forward. We will also discuss what are the right timing to get these vaccines, some special situations, and what are contraindications for these vaccines. So let's get into vaccination in older adults. And I'll use as a disclaimer that what we want to discuss now is what is approved by the CDC and FDA as of June of 2021. Now, I'm giving this disclaimer because with the current COVID-19 pandemics, there is a revolution in the development of vaccines using this new technology called the mRNA vaccines. I'm not going to get into the details of those, but we are very eager to see what's the future of vaccinations using this new technology, so things can change. That's the reason for the disclaimer. So now let's dive into this. This is extracted from the CDC, and it is the schedule, the vaccination schedule for adults in the US. From here you can tell on the left side there is this white column that lists all the medications that are needed for adults, and you have different age groups up here. So you have from 19 to 25 to 26 years old, then up to 50 years old, and then beyond 65 years old. Many of these vaccines that you're gonna see listed here sometimes are assumed to be given during childhood, especially if you were born in the US, if you live in the US, but also if you come from other countries with well-structured health systems. We can assume that most of these are given at an early age. So many of these vaccines would have been received at an earlier age and do not apply for adults 65 years and older, which is the group that we're discussing right now. But I want to highlight from here that probably the 2 or 3 most important vaccines for adults will be those related to pulmonary infections, just like this PCV13 and PPSV23. So this is for pneumococcus. This P stands for pneumococcus. And the pneumococcal vaccine has been regarded as one of the most effective ways to decrease the pulmonary infections or pneumonia in older adults, which remains a very common cause of death in this population. And it is the same situation with influenza listed here. So it's one of the most important vaccines as we go from 65 years and older. We're lucky that influenza will also decreases the chances to get you in the hospital from other reasons. For example, in people who have COPD or that have some heart failure, that have some chronic lung conditions. Influenza is a very the influenza vaccine is a very effective way to keep people out of the hospital, especially during the season of influenza. We'll go over each vaccine in the next few slides, but this is what I want to show you, the big picture. Another vaccine that is very important for adults, it is varicella vaccine, the zoster recombinant vaccine that you see it gets listed from here, from 50 years and older. And it's a vaccination that adults should consider to prevent more exacerbations or more episodes of shingles. Other vaccines here listed, for example, MMR, Tdap, meningococcal, and this hepatitis A, hepatitis B. These are vaccines that are probably most effective in populations at a higher risk, that are younger people or adolescents or young adults that might be exposed to these pathogens more often. But certainly, if older adults have not received these vaccines, they should consider getting these vaccines to prevent infection. Now, all these vaccines have specific indications and have specific benefits that have been described. So there are also some special situations to avoid some vaccines, as we will discuss. And of course, here we're missing the COVID-19 vaccine. Well, many of these COVID-19 vaccines, because there are many available, which are not listed here, but we're gonna discuss those separately in the next slides and talk about specifically about the data on older adults and how is this vaccine performing. Which I have to say personally, it's one of the greatest breakthroughs in human history to develop a vaccine this fast. Okay, so let's start with influenza. Influenza is a respiratory virus that results in severe infections, anywhere from 3 to 5 million severe infections yearly worldwide. This virus has a reservoir. That means that it lives inside avian species of birds. So you can imagine geese, they carry the influenza virus in their guts. Same thing with chicken, for example. They carry the virus in their gut and they excrete the virus and then gets in touch with humans, and it becomes evident during winter season, and it continues to transmit over and over until summer happens, and then it decreases the transmission after that. So from this transmission, more than 500,000 deaths occur annually. Some estimates put it anywhere around 650,000 deaths on a yearly basis from influenza. Because this happened during the winter season, the vaccination starts in September. And the effectiveness of this vaccine, the efficacy of this vaccine has been regarded anywhere between 40 to 58%. There are different forms of the influenza vaccine. We usually give the vaccination that is not a live virus. That means that you cannot get infected from it. But there is a form of a live vaccine that is given the actual virus, but with an attenuated response. So it's like a beat up virus. But we cannot give that to immunocompromised people. Now let's talk about some special situations with the influenza vaccine. The influenza vaccine contains egg in its process of development. So there are some concerns of egg allergy and receiving the influenza vaccine. However, egg allergy is not a reason to avoid vaccination. Instead, what we do is that we monitor for allergies. Now, if you get the influenza vaccine and you develop a severe allergic reaction to the vaccine, that is a good reason to stop getting further doses. Also, there is another side effect that has been noticed with influenza that is called Gilean-Barrett syndrome. So, to explain this simple, imagine your body starts creating some antibody against the vaccine to fight the vaccine, but then it happens to target the nerves, and people get this get paralysis of the muscles. They're unable to move their body, and that takes anywhere within 6 weeks after getting the vaccine for development. That is an absolute, if that ever happens, that's an absolute contraindication to get another dose of influenza anytime during the lifetime. But it is very rare. We don't see it as often. And as I mentioned, there is a live form of vaccine with influenza. So it's like basically you get an influenza virus that is incomplete and it's unable to fully attack yourself. But there is still, in order for us to make these vaccines the safest as possible, we try to avoid this type of vaccination in anyone 50 years or older, in anyone with any problem with the immune system, pregnant patients, or any other patient with lesions inside the brain or the skull that will communicate to the outside, or in people with cochlear implants. So these cochlear implants, they also get inside and outside the skull. So that counts. Also, one of the contraindications to receive a live attenuated vaccine is after receiving any influenza antiviral medication, and it's just because you will kill the vaccine just by getting these antiviral medications. So now let's talk about pneumococcus. Before COVID-19, I would say that the two most important vaccines for elderly adults were pneumococcus and influenza vaccine. But they're still a very important vaccination for elderly people to prevent respiratory infections. Pneumococcus is kind of the short form of what we call the Streptococcus pneumonia, which is a bacteria responsible for bacterial pneumonia. It's very common. This Streptococcus or the pneumococcus lives in our mouth. Most times it can also live in our lungs. But sometimes it decides to grow too fast and too quick, and then it overwhelms the body's ability to heal. We see high mortality in elderly and also in children with this bacteria. And as I mentioned, there are many bacteria that can cause pneumonia. So this is one of the bacteria that can cause that. This is one of the most frequent. But within these bacteria, there are different variations of these bacteria that can result in pneumonia. So in the 1980s, one vaccine called PPSV23 had components, had different pieces of 23 different variations of pneumococcus. So in theory, it will elicit antibody response against these 23 different variants of pneumococcus. So it was a wide protection. And this PPSV23 is regarded up to 70% effective in decreasing infections from these bacteria. And then later, there was another vaccine called PCV7 that was introduced sometimes in the 2000s, but then it was changed to PCV13, which basically has other 13 different variations of the pneumococcus and has been proven to be 75% efficacious against these 13 type of variants. But not only that, it also decreased the chances of getting an infection, a streptococcal infection, a pneumococcus infection from other variants, just not as effective as it was for these 13 specific types. So it is 45% efficacious against other type of non-invasive pneumonia. So there are basically these are the two currently available pneumococcus vaccines, and they have specific schedules. But in short, we can say that the PCV13 is given after 65 years of age, and the PPSV23 is given either before or after. Now, shingles, we discussed many times shingles now. I would say that in summary, we have two different type of vaccines for shingles. So the one that is indicated for people 50 years and older is the recombinant zoster vaccines, the one that is called Shingrix. And this vaccine is given to prevent any shingles episodes, regardless of whether you had shingles or not, because even in people who had shingles before, it decreases the reactivations or the relapses from these infections. And we believe that is because it is stimulating the immune system. It's like getting a booster. Even if your body knows the shingles virus, getting the booster of the vaccine, which is going to be just a part of the virus, is going to boost the immune system to prevent further infections or reactivations. In healthy adults, shingles will present as a painful lesion and will eventually clear, but we also see severe forms that can involve the brain, liver. We don't know specifically what is the effectiveness of these vaccines to decrease any of these type of overwhelming type of presentations, but still highly recommended for older adults. Now, the following vaccines are vaccines that were probably already given as a child. This measles, mumps, and rubella vaccine. Usually it's given to people that don't have proper documentation of immunity. That means a blood test or a certificate of a doctor, or you can skip it if somebody was born before 1957. So around this year is going to be people 64 years or older. And this vaccine is contraindicated in people with immunodeficiency because you can get infection from it. One good thing from this vaccine is that it can also be used after exposure to measles if we know that the patient who was exposed didn't have good history of measles documented. So if there is any question whether measles can be a problem, this vaccine can be given to prevent disease, in addition to immunoglobulin also. But this is for measles only. These are also two vaccines that are highly recommended for people who were not vaccinated before. That's Tdap, that will prevent against pertussis, diphtheria, and tetanus, and can be given as a booster in case you experience any wounds within 5 years, or it has to be given every 10 years as booster. Also, the Haemophilus influenza type B vaccine, that's for people who don't have a spleen, and there are specific indications for that. Usually more, I would say it's more important for younger adults or kids. And similar situation with hepatitis A, hepatitis B, and meningococcal vaccine. but strongly recommended if not given in adulthood. Now I'm going to cover a few words on COVID-19 vaccination in older adults. By the time when I was requested to do this talk, I didn't think this will be a topic to cover, but we have advanced so much and we have so many vaccines available. And again, the same disclaimer, this is information as of June of 2021, and things can change. But currently, this is what we have. So COVID-19 vaccination is strongly recommended for adults 65 years and older. One of the main concerns with this type of vaccines is an allergic reaction to this. And what has been implemented is monitoring. Anywhere from around 30 minutes after getting the vaccine is good enough to monitor for these type of reactions that usually happens very often. There is specific concern for vaccines side effects with something called thrombosis and thrombocytopenia syndrome using specifically this Johnson & Johnson vaccine. But this has been observed only in women younger than 50 years old and has been noted in 7 per 1 million vaccinated women. I think as of today, there are less than 50 cases reported, but still something that we have to learn from. Also, myocarditis, pericarditis, which is a form of heart inflammation, has been observed in younger population and has nothing to do with older adults. Now, why is it important for older adults to get the COVID vaccine? And I assume that as of today, that there are around 70% of the adult population in Minnesota has been vaccinated. Many of you that are listening to talk are going to be vaccinated by now. And we're still getting information on this vaccine. And for 65 years old and older patients, the effectiveness, taking into consideration the hospitalization, is up to 94%. So if you are fully vaccinated. So that means that with a full vaccination, you decrease the chances of getting into the hospital dramatically if you receive the full vaccination schedule. Unfortunately, the toll of COVID-19 has been observed in the elderly disproportionately to other age groups. So this is a major breakthrough and is strongly recommended if you haven't received it. Well, thank you for your attention, and I hope this was helpful. Until next time.